Okay, guys, so we're going to try this again. I apologize. I'm still trying to learn how to work out Zoom. It's killing me here. Um, so I'm starting back at the beginning of the slideshow because I didn't want to have to download half of it. Um, so we're going to get started. I'm going to repeat a lot of what I've already said, just so we have it downloaded. So we'll get started here. As always, I'm going to kind of jump ahead to the actual class portion. We've done this. We did course description. Um, One other thing before we go any further, if you see me looking up and not at my camera, it's because I have my big screen above me. I'm hooked to my computer, and sometimes it's easier for me to follow that. So we talked about EMTs are the backbone. They provide emergency care. So state to state, your protocols are going to differ, and your requirements differ. So nationally, you're supposed to have a high school diploma or equivalent. You have to prove that you've had vaccinations. If you haven't, then there's certain paperwork that has to be done. You've completed a background check and a drug screening, and you have a valid driver's license. So you complete the course, you have to take the certification exams, which I told you we do an end of the class exam. I think you get two or three attempts at that. You'll do your state exam, and I think you can have three attempts. Then you have your national, and I believe you get three. And then if you failed, you have to do a remediation, and then you get three more attempts, maybe. That's either EMT or advanced. I'm not positive. Compliance with other state, local, and employer provisions. So the ADA, American Disability Act. Um, I was trying to hurry earlier because I knew I was on a time limit. So I'm gonna use myself a lot as an example, because of what a screwed up mess I am. So, like my severe dyslexia, um, I did not ask for any accommodations, but legally they would have to give them to me if I needed them, and that's for the class, the test, and for work. Um, And that might be setting at the front of the classroom. That might be using a slant board. That might be asking if you can actually take a tape recorder, which nobody uses anymore, and record the lecture. Anything that helps you understand the course better or do the job better, whatever it might be, they have to provide. So that's your American with Disability Act. When you go to take your national, if you have a learning disability, there's a few hoops to jump through, but you can also have that type of help for taking your test. Sometimes people need it read to them, and we can do that. So Title I of the ADA protects EMTs with disabilities who are seeking employment, may require modifying the work environment and how the job's performed, and background checks. History of EMS, we kind of hit on it a little bit. So volunteer ambulances in World War One. This was kind of people running out there, grabbing people and taking them to a tent, and they would amputate legs or whatever. Kind of like back in the Civil War. You've seen videos and stuff. Not much different in World War One. In World War Two, the field care became a little better. You had medics that traveled with each deployment, and then, like we talked about, that Korean conflict, you started having field medics and rapid helicopter evacuation. This is where they started getting actual training under physicians, so they could do that quick emergency treatment. So 1966, accidental death and disability. You're going to see that on some tests or some quizzes. It's nothing huge, nothing you need to go research. 1970s, DOT published the first EMT training curriculum. This one I was talking about. If you've ever seen the TV show Emergency, awesome TV show for as old as it is. And the deeper you get into this, I highly recommend you watch a few episodes of it. It's pretty cool. 1973 Emergency Medical Service Act. And then in 1971, the AAOS published the first EMT textbook. So it was a national, this is what we're doing, this is how you do the job. National standards. kind of the same stuff. So in the 70s, the DOT, National Standard Curriculum, 1980s, advanced level of EMT. So this is where they took it from, like I said, take a left to the mortuary, take a right to the hospital. So this is where we started really getting into, we were training different levels of EMTs to do different levels of care. Agenda for the Future was in the 90s, and then 2019, that Agenda 2050. So levels of training, you got your federal level, that's your national level. That's your nationally registered EMT. That's what that is. State level, you've passed the state test, you've got a state license. And then your local level, medical director provides oversight and support. Um, I can tell you right now, you're not going to get a job in EMS without your state and national license. So your medical director does the day to day. They're the ones that says, yes, you can go out and do X, Y, and Z. Then you have your state EMS. They regulate the roles, legislation, the on-say role, and then your national EMS scope of practice. This is the big picture. Everything we can do in the United States as a medic, and then our medical director picks and chooses out of that umbrella what we're allowed to do on our service. So the public, there's tons of people out there that are trained in BLS and CPR. So BLS, basic life support and first aid is what that is. And then a lot of people who are trained in CPR are also trained in AED, so the automatic electronic defibrillators, which we're going to talk about in chapter 15. So what is an emergency medical responder? This includes your law enforcement officers and your firefighters. They initiate immediate care and assist EMTs on arrival. And their main focus is to start care. If there's severe bleeding, they put direct pressure. If there's a broken hip, they might try to stabilize it. If there's a car wreck, they're going to take C-spine and make sure that patient doesn't move. That's what a first responder does. So once again, we'll break down the different levels. So you've got your emergency medical technicians, which what you guys are going to try to do here. That's 150 to 200 hours. And that's including our skills. That's including your clinicals. The EMT has knowledge and skills to provide basic emergency care. Uh, the EMT assumes responsibility for assessment, care, package, and transport, which I broke that down earlier, and we're going to break it down for the next several months. So not going to go into that. The advanced EMT, so like I said, we do IVs, we administer airway adjuncts, which we'll get into that. It's not on here, but in the state of Oklahoma, an advanced EMTs are also allowed to intubate. And then we administer a certain limited number of medications. I think I've got like a handful, like 12 medications I can give or something. Paramedics, 1,000 to 1,300 hours in the classroom. They can do all kinds of stuff, and it covers a huge range of ALS. So, as an advanced, I'm considered ALS, but I'm ALS level 1, where a paramedic is ALS level 2. Let's see, components of EMS systems. So, comprehensive quality, convenient care. So, we know what we're doing. It's good care, and we can get it to them quickly, conveniently, and we are available. Evidence-based clinical care. This is what we talked a little bit about, I think, where we take things that have proven to work nationally, and we use those because they're proven to work. Um, Efficient, well-rounded care, preventative care, that's the bicycle helmet, the seat belts, the putting a fence around the swimming pool so kids can't get in it, that kind of stuff. It's preventing an incident. And then comprehensive and easy accessible patient records, which we're going to get into that in chapter 4. Public access 911 system, access public safety. So then you got your dispatchers, obtain information and dispatch resources. Your emergency medical dispatchers, which, like I said, can give step-by-step care. And then mobile app assist with layperson CPR and AED locations. I'm going to jump back to your dispatchers. Since I'm not timed, we're going to talk about this for a minute. As you're going to learn, we get dispatched out to a scene. What dispatch tells us isn't always what we find. Just prepare for that. I'm going to give you scenarios where I give you one scenario, but when you start working your patient, you're going to find something else wrong with them. Um, that's because if your loved one was hurt and you called dispatch, you might blow it way out of proportion, or you might forget to tell me they've also got a broken leg because the split on their head was bleeding profusely. Um, so don't blame dispatchers. Dispatchers do all they can to help us. Keep in mind they can only give us information as good as what they receive. Human resources. This will be a quiz or test question. Focuses on people who deliver care. EMS Agenda 2050 encourages an environment where people want to work. We talked about medical directors. Um, I will pull up protocols in the classroom and show you guys, um, and you'll see how protocols actually work. I'm sorry, there is a fly driving me nuts in here. Um, so my protocols are a list of things I can do, what order to do them without calling for permission. That's what my medical director allows me to do. Offline, I follow protocols. Online, I'm on the line with him, whether it's radio or phone, it's probably going to be phone, saying, hey, I gave aspirin, I gave nitro, they're still going down. What do you want me to do next? So I'm actually asking permission or asking advice for online medical direction. Legislation and regulation. So training, protocols, and practices follow state regulation. Senior EMS officials, these are your directors and supervisors. We talked about that. They do scheduling, personnel, budget, purchasing, and vehicle maintenance. We are actually all responsible for vehicle maintenance, and I think that's a different chapter on some of our responsibilities. So, integrated in healthcare system. So, pre-hospital care is coordinated with hospital care. We want to start care on scene, and we don't want to go backwards. We always want to move forward. So when we get to the hospital, they don't have to repeat stuff. We want to continue that care. We never want to move backward because we're dealing with someone who is injured or sick or hurt, and that's just killing time in their care. And if it's bad enough they've called an ambulance, then it's bad enough we need to move forward and keep going at a good pace. So pre-hospital care continued in the emergency department. Integrated Integration ensures comprehensive continuity of care for the patient. And that's what I was just talking about, always moving forward. So I arrive on scene, I get my vitals, I get my history, I get my med list, I start treating that patient. When I get to the hospital, they shouldn't have to do anything back here. It should continue to flow forward. Method of delivering health care, utilize the pre-hospital spectrum, involved with the goal to facilitate improve access to healthcare at an affordable price, and healthcare provided within the community by a team of professionals. The MIH created additional training levels for EMS providers, including community paramedicine. So what paramedicine is, it's paramedics that have went and took extra training and they can more or less do house calls, is what that is. Computer systems are used for documentation of patient care. And we're going to get into that in chapter 4 when we do documentation and communication. Um, Electronically stored information can be used to improve care. And we talked about this a little bit. This is where they're going to take run reports around the nation and they're going to go, yes, giving 324 milligrams of aspirin does seem to help during a cardiac arrest or chest pain, an angina event, um, or IV Tylenol does prove to work faster than PO Tylenol because they're looking at 5,000 different reports where it proved that it would work right. That's why we use the electronic systems. They're quicker, they're simpler than the old handwritten ones, and they can help us improve EMS. So evaluation. So your medical director is responsible for maintaining quality control, adopting a just culture. So promotes a learning culture that holds employees accountable for their behavior choices by balancing fairness and accountability. If you screw up, you admit to it. We learn how not to screw up again and we fix it. You'll hear me say this in class. I truly, truly believe it. It is never a failure if you learn from it. We can screw up every single class during, doing assessments or whatever, or taking tests or taking quizzes. You can fail them. You cannot pass that test, but if you learn from it, then it's not actually a failure because you'll never forget that again. Um, and as we go through class and I tell you some of my personal stories, you will realize even a full-time medic makes mistakes all the time. I will never make the same mistake twice. So it's not a failure. Continuous quality improvement. Review and perform audits of the EMS system to identify areas of improvement and or assign remedial training. Minimize errors is the goal and use the plan, do, study, act cycle. Um, you might want to remember this. I don't remember. This might be a quiz question, but what you really need to remember is what quality control assurance or improvement is. This is where your medical director or your supervisor reads over your reports and they make sure that you are following your protocols. If you're missing something big, like you've had 6 or 7 respiratory calls and you never once gave a breathing treatment or you didn't administer oxygen, then they might have you take a remediation course where they're like, okay, you're going to get set down and you're going to take a respiratory course. And that's just to improve you because they're paying attention to your reports and they're noticing you're making mistakes. Let's see, patient safety. So minimize medical errors that occur as a result of a rule-based failure, a knowledge-based failure, or a skill-based failure, or a combination. Rule-based failure, you didn't follow protocols. You went off the rail, you went rogue. Knowledge-based, you didn't know what to do. You somehow didn't have the knowledge and you tried to do it or you failed to do it. And then skills based kind of goes hand in hand with that. You tried to do it and you did it wrong. Um, Skills is what we're going to learn our hands-on portion. We're going to learn how to do CPR. We're going to learn how to do a patient assessment. We're going to learn how to administer oxygen. So those are all skills that we have to know. Um, it requires the effort of both EMS agency and EMS personnel. We don't want these type of failures because it affects patient outcome. It affects patient safety. Um, Example, I got a patient complaining of chest pain that moves into their shoulder or chest pain that's moving into their back, and I make them walk, you know, 20 yards from the house out to the ambulance instead of putting them on the cot. That's a failure, because could potentially worsen that patient's condition. Finance system varies depending on organization involved. May be Personnel may be paid, volunteer, or a mix. EMTs may be asked to gather insurance information, secure signatures, and obtain permission from the patient to bill insurance. There is no you may be asked to, you will. That's part of your reports. We're going to talk about it in chapter 4, but we need to get their insurance information. Excuse me. A lot of times it will be on the face sheet that we receive from the hospital when we leave. We have to have signatures from the patient, from your partner, and also usually from the receiving facility. And then one of those, or that signature we get from the patient is actually, hey, I'm getting permission to transport you. I'm not kidnapping you, and I'm going to bill your insurance. I'm not going to bill you. That's how I word it whenever I get that signature. Let's see. In 2020, the Center of Medicare and Medicaid Services implemented a pilot program called Emergency Triage, Treat, and Transport, or ET3. Reimburse EMS systems for providing the right patient care at the right time, set up a payment model for patient transport and alternative destinations. You really don't need to know any of that. honestly, when I read this last night, I went over this chapter before I taught it. I'm like, I don't remember any of this. So it's not that important. EMS instructors licensed in most states. Um, right now I'm considered an adjunct or a guest speaker, if you will. Brooke has my paperwork. I will be licensed very shortly. Um, Most EMS training programs must adhere to national standards. Continuing education, refresher courses, computer-based or mannequin-based self-education exercises, measures intended to maintain and update EMT skills and knowledge. Once again, we're going to jump back to we take all this evidence and we say this is what's working nationally. Um, hey, we learned that 30 compressions to two compressions is better than 15 compressions to two compressions. Um, so what did we do? We made a whole new curriculum and we retrained. We did refresher courses. So you, as an EMT, have to have an X amount of refreshers or uh, CEUs, continuing education hours, um, every 2 years. And it just keeps us up with the most up-to-date medical education that we can get our hands on to benefit our patients. Prevention and public education, two components of the EMS system with a focus on public health. Emphasis is on prevention, EMS workers with public health agencies on primary prevention and secondary prevention. So here are just some preventions and public education. My EMRs know this. You new people that are in class with me, you're going to learn I preach. You need to know this stuff so that you can educate your patients. Um, you're going to hear this a lot from me. The more knowledge you have, the more your patients trust you. The more you can teach them in layman terms, the more respect you're going to gain. The whole point of that is as we get into this course, I'm going to ask you to explain things to me as we go because I want you to be able to teach your patients. Because if you can tell them why you're giving a medication or why you're doing something and you can do it to where it makes sense, they're going to think you're the greatest medic in the world. So, EMS research helps determine and shape EMS for the future. Evidence-based medicine focuses on procedures that have proven useful in improving patient outcome. We've been talking about this whole chapter. Many EMS systems and state consults the National Model EMS clinical guidelines with the National Association of State EMS Officials. That's a whole lot to say. Based on a review of current research and expert uh, consensus, we take all the information, we find what works best, and that's what that we want to use. So, roles and responsibilities. I guess I thought it was a different chapter. I guess it is this chapter. Keep the vehicle and equipment ready. So this is going to involve our daily truck checks. We check the tires, we check the fluids, we check, make sure we have oxygen, all of our equipment up to the state standards. Ensure safety. Be familiar with emergency vehicle operations. So if you go to work somewhere, you will take an EVOC class so that you can drive that ambulance or that fire truck, whatever. Provide on-scene leadership and perform scene evaluation. When you guys go to clinicals, I want you so comfortable and so good that you, as a brand new person, can jump on scene and be a leader. You look at that patient and you hear them wheezing, you can go, hey, I need to go ahead and give a nebulizer treatment. I want to listen to the lungs. I want you guys to be that leader. Leaders know what to do without being a boss or being a butthead about it. Scene evaluations, we're going to get into that later, so I'm not going to spend a lot of time there. Call for additional resources as needed. Um, so once again, this is part of your assessment. If you do not have the material, enough of the material or enough of the equipment to handle a patient on scene, you need to call for additional resources. If you go on a car wreck and the person was ejected, we immediately call for a helicopter per my protocol. Um, so that's calling an additional resource. We go on a wreck and there's fluid running across the highway, we call for law enforcement to block the roads. We call for the fire department to help us take care of that fluid. We might even have to call hazmat depending on what the fluid is. And then we want to gain access to that patient once we are safe, once it is safe to do so. Perform a patient assessment. We're going to get into that later. Give emergency medical care while awaiting additional medical resources, which is an EMT, you are the medical resource. Um, give emotional support. You're going to hear me get on soapboxes about this too. We have got to be understanding. We have to be sympathetic. We have to be empathetic. Um, some of the stuff that we do is very, very hard for us and the patient. Remember that this is their emergency, not yours. And I'm going to tell you stories in class, but um, we keep our stuff together. We don't break down. We stay professional until after that call. We are there for them. You have to remember, not my emergency. We are there for them. Maintain continuity of care, which we talked about. Resolve emergency situation or incidences, uphold medical and legal standards, and ensure and protect patient privacy. We'll get into that later too. Give administrative support, constantly continue professional development, cultivate and sustain community relations, and give back to the profession. Okay, our personal attributes. So integrity, empathy, self-motivation, appearance, and hygiene, self-confidence. Um, yeah, I'm trying to think how I want to go that. We're just going to start with self-motivation. We do this job because we love helping people. There's a thing called burnout. You've all heard about it. It does happen, and it sometimes it's really hard to get up and go to work every day, knowing that something bad could happen. But we do it because it's who we are. It's what we do. That appearance and hygiene, you're going to have uniforms, keep your haircut decent, shower once in a while, that'd be great. Uh, self-confidence, this is a big one that I am really going to hammer home in class. Um, you got to believe in yourself. You put in the time to learn this, you put in the effort, you can walk into any scene and you can be confident that you know what you're doing. And I've seen medics who have no self-confidence and they are the worst partners ever. So I really, really hammer on this in the classroom. So time management. Um, this is one reason I really pick on my classes that I want you there 15 minutes early. We might sit there and just BS for 15 minutes, but I want you there 15 to 30 minutes early. Get in there, get comfortable, get your stuff ready. If you're bringing food and drinks, that's awesome. I don't care. That 15, 30 minutes is when we get to know each other. That's how we're going to build that relationship. And it's the same way with work. You get there 15, 30 minutes early. You talk to your coworkers. You get your stuff prepared for the day. That way, when them tones drop, 5 minutes before your shift actually supposed to start, you're ready. We can roll out the door. Communications. Um, communications key. We've all heard that. Teamwork. Sometimes it's hard depending on your partner, but when we step into a uniform, we're on a team. We have each other's backs. Respect, we are going to respect each other. Patient advocacy, so we are the voice of that patient. When we start treatment, we stand up for that patient no matter what and no matter to who. Um, careful delivery of care. That one's kind of self-explanatory. Professional attributes. So every patient is entitled to compensation, respect, and the best care. EMTs are bound by patient confidentiality. And then there's HIPAA, the health insurance probability accountability. I can't say all that. We've talked a little bit about compassion, respect, and best care. So I don't care if it's your worst enemy. I don't care if it's a child abuser, a sex offender. Um, everybody, when you're in that uniform and you're on that truck, everybody gets your best. Uh, there's no other way I can put that. Everybody deserves your best when you're on that truck or in that uniform. Confidentiality, we talked a little bit about this in orientation and the HIPAA rules. You're really not supposed to talk about a patient to anybody if they weren't on that call with you. With that being said, there are times that you can go to your supervisors or your directors, or you can go to therapists, which we're going to hit that later. Those are the people that you can go talk to. Um, don't go home and tell your wife and your husband or your boyfriend and girlfriend everything. So, review. There's 10 questions on here. We're going to do this real quick. So, which of the following is an example of care that is provided using standing orders? Medical control is contacted. The EMT defibrillates a patient in cardiac arrest, begins CPR, and then contacts medical control. A physician gives an EMT an order, or following an overdose, the EMT contacts medical direction. So I only read part of those for a reason. An example of care that is provided using standing orders. So I know that's a little bit different wording. So you guys are just going to have to get used to this too. Hang on. Where is my mouse? Well, oh, come on. Oh, sorry. I've got two computers going. I was using the wrong mouse. Okay. So right here is the word I want you to notice. Standing orders. Okay. That's not online orders. So this one right here is the only one that they did not call in before they treated. So the answer is B. Standing orders, a form of offline. Okay. That kind of makes me sad I can't use my highlighter. Um, oh, son of a buck. It left it on there. Sorry. Ignore my highlighter. Um, Quality control is an EMS system. In EMS system is the ultimate responsibility of the. So remember, quality control is when they relook at our paperwork and decide if we did good or bad, right? So that's not the paramedic. The lead EMT, that's who's responsible to do the report to begin with. And EMS administration, they might look at it, but at the end of the day, it's the medical director. So quality control and gosh dang it, I just screwed that one up. So the answer is C, obviously. Upon arrival at the scene of a domestic dispute, you hear yelling and a sound of breaking glass from inside the residence. You should. We haven't really talked a lot about it, but we always make sure our scene's safe. If the scene is not safe, we don't go in. So we are going to retreat and we're going to call police to kind of help us out. C. Sorry, I screwed that up. Number 4, which of the following is not a component of continuous quality improvement? So as we test, pay attention to those trick words. What is not? Uh, Periodic review of run reports, discussion of needs for improvement, negative feedback given to those who make mistakes while on a call, or remedial training as deemed necessary by the medical director. I had to double check myself there. Yes, it's negative feedback. We don't need negative feedback. It needs to be positive feedback. If there's a problem, then we will review, we'll discuss, and if we need to, we remediate. All of the following are responsibilities of the EMS director except evaluating patient insurance information, serving as liaison, ensuring that the appropriate standards are met, or ensuring appropriate EMT education is continued. We're continuing training. So the medical director is not going to evaluate the insurance information. A. Which of the following situations would most likely disqualify a person from EMS certification? A misdemeanor committed at 17, driving under the influence of alcohol, possessing a legal driver's license or a valid driver's license, a mild hearing impairment. I hope not, because that would be me. Um, so you can lose your license if you get caught and you get a DUI. So B. Which of the following should be the EMT's highest priority? Controlling severe bleeding, maintaining a patient's airway, ensuring patient safety, ensuring personal safety. So as we get into this, you will learn it's always BSI, as my scene says. So body substance isolation. We always put our gloves at minimum on. And then is the scene safe? So I'm protecting me and my partner and then my patient. So ensuring personal safety is the highest priority. Moving on. A patient who requires cardiac monitoring in the field would require, at a minimum, which level of EMS provider? So if you've read your chapters like you're supposed to, um, an EMR, an EMT, a paramedic, or an advanced EMT, it's going to be paramedic. Paramedics uh, can read and interpret a 12 lead or a cardiac monitor. Which of the following is professional responsibility of the EMT? Telling the family of a dying patient that everything is okay, maintaining only the skills that he or she feels comfortable with, maintaining a professional demeanor in even the most stressful situations, uh, advising the emergency department nurse that patient reports are given only to the physician. So we want to maintain a maintain a professional demeanor. I about screwed that up. And then lastly, emergency patient care occurs in progress or in progressive phases. What occurs first? Activation of EMS, initial pre-hospital care, the patient receives definitive care, or the incident is recognized. Well, we got to recognize that there's an incident before 911 can be called, right? So it's D. Incident recognition comes first. So, guys, that's chapter one. Wow, it got dark real quick. So, I don't want you not to know this stuff, but I don't want you to like spend all of your time focusing on it. Most of this we're gonna see once or twice in test, and that's about it. You need to know to follow the rules. You need to know that you need to have a license. Um, I'm just trying to recap on the chapter. We're going to cover most of what we talked about tonight in other chapters more in depth. So, all right, thanks, guys.